Hey guys, this is Dr. Ryan. I want to talk to you today about disc degeneration. So what that means, what it looks like, and things that you can do to proactively prevent the progression of it. Now, disc degeneration is one of the most common things that we check for every time we do spinal x-rays with somebody. And it comes in phases. And what I mean by that is if we look at this model right here, on this end, this is a textbook healthy normal spine. We can see here that the disc, which is this cushiony pad in between the bones, that's nice and full, and the bones are nice and healthy. Now, when somebody loses or shifts outside of what a normal alignment is, let's say someone loses the curvature in the neck, what we see is a phase 1 degeneration, where there's more pressure being placed on the disc, there might be a little bit of thinning on the disc, and if this stays long enough, eventually what we see is phase 2. And the difference here is that we see further thinning of the disc and the bones actually start to change. Now, phase 2 and phase 3 are both things we can work with to functionally correct. If phase 2 stays long enough and we see phase 3, which is almost bone on bone that you can see right here, that's no longer something that's functionally correctable. However, we can still work with someone to improve their quality of life. Now, the discs rely exclusively on movement to stay healthy because after puberty, they actually lose most of their blood supply. And so when someone's subluxated or those joints are really locked up, it's going to exacerbate or progress that disc degeneration even faster. So a great way to stop the progression of disc degeneration is actually through routine chiropractic care, keeping those joints nice and mobile. And something that's really interesting is that our current research shows that up to every 2 weeks for routine adjustments is great for keeping disc degeneration at bay. It's great for stopping the progression of it. After 2 weeks, though, we don't really see much of a benefit. So that's one of the main reasons why we recommend routine chiropractic care, especially if disc degeneration is present.